Hyaluronic acid is one of the substances produced in the body and has a function to keep the skin elastic and moisturized due to its high water retention capacity. But the amount of hyaluronic acid produced decreases with aging. Therefore, it is hyaluronic acid injection that intentionally increases the amount of hyaluronic acid from the outside. Hyaluronic acid is a substance that is originally present in the body, and since the injected hyaluronic acid is gradually absorbed into the body and has no lasting effect, hyaluronic acid injection can be said to be one of the easy treatments. However, while it is an easy procedure, it carries various risks. In order not to cause a risk, the guideline for the injection amount and the layer of skin to be injected are set. But if you know what to do in the unlikely event of a failure, you can receive hyaluronic acid injection with confidence. If the injection amount or injection location is incorrect, it can lead to serious conditions. When injecting hyaluronic acid, if the blood vessels are indirectly compressed or if hyaluronic acid accidentally enters the blood vessels, the hyaluronic acid may become a blood clot and cause blood flow disorders. When blood flow is impaired, blood cannot reach where it is needed, which can lead to serious problems. Injection site where blood flow disorder is a concern: near the eyes, nose, forehead, nasolabial fold. The external carotid artery, which delivers nutrients to the skin and scalp, and the internal carotid artery, which delivers nutrients to the cerebrum, pass near the eyes. If a blood clot forms in the internal carotid artery that connects to the brain, it may cause a stroke, such as a cerebral infarction that clogs a blood vessel, or a cerebral hemorrhage that breaks the blood vessel. The following symptoms may occur suddenly as a precursor to a stroke: slurred speech does not turn, numbness or paralysis of limbs, words don't come out, mouth does not close, a feeling of strangeness on the face, headache. If these symptoms are left untreated, speech disorders and paralysis may remain as sequelae, which may lead to serious situations, so please consult a medical institution immediately. The internal carotid artery is branched into the ophthalmic artery, which not only carries nutrients to the cerebrum but also delivers nutrients to the eyeball and optic nerve. Therefore, when a blood clot is formed, the eyeball and optic nerve at the tip of the blood clot may stop working and lead to blindness. The following symptoms are signs of blindness: sudden loss of vision, sweating, nausea, headache, things look double, difficult to move the eyeball. It is said that the deterioration of eyesight caused by hyaluronic acid can be cured or slightly injured by treating it within 1 to 1.5 hours after the above symptoms occur. If you feel any discomfort after the hyaluronic acid treatment, please consult a medical institution immediately. Hyaluronic acid-induced sebum necrosis can occur mainly by injecting hyaluronic acid into the glabellar, nose tip, and nasolabial fold. It occurs when blood vessels are compressed or blood clots block blood flow, preventing blood and nutrients from reaching the tissues beyond the blood vessels. When blood flow disorder, which is suspected to be necrosis of the skin, occurs, the color of the skin becomes white and changes to red, purple, and black. If you notice any abnormalities in the eyebrows or the tip of your nose, or if the color becomes unnatural, please consult a medical institution immediately. It is a symptom that occurs mainly when injected into the temporal region or forehead, and in rare cases you may feel pain that causes the head to tighten. It is caused by pressure on tissues and nerves by the injected hyaluronic acid, but it tends to subside in 2 to 4 days. Also, if you experience headaches when injecting into areas away from your head, such as your nose or glabellar, you may have impaired blood flow. In that case, there is a risk of stroke, blindness, and skin necrosis, so please consult a medical institution. Since there are individual differences in the skeleton and fat mass, it is necessary to adjust the injection volumes in milliliters units when injecting hyaluronic acid. The injection is adjusted to an appropriate amount, but if the result is an overinjection of hyaluronic acid, the following symptoms may occur. Feeling of tension. By injecting hyaluronic acid, the volume of tissues present in the body increases rapidly and pushes up the skin, which may pull the skin and make the skin feel taut. The higher the amount of hyaluronic acid, the stronger the skin feels more taut, than when the proper amount is injected. Lump. Hyaluronic acid is absorbed by the body over a period of 1 to 2 years when an appropriate amount is injected. However, if you inject more than an appropriate amount and hyaluronic acid remains in the body for a certain period of time, a collagen film will be formed around the hyaluronic acid, and the hyaluronic acid will not be absorbed by the body and may become a lump. Risk of hyaluronic acid flow. When injecting hyaluronic acid into the nose or chin, hyaluronic acid may flow around the nose or chin. Hyaluronic acid has different hardness depending on the size of the particles. The larger the particles, the harder it becomes, and the smaller the particles, the softer the hyaluronic acid. In hyaluronic acid injection, the treatment is performed using hyaluronic acid whose hardness varies depending on the desired treatment effects and the injection site. By using hard hyaluronic acid, it is possible to form contours that shape the nose and chin, but if you inject soft hyaluronic acid that is used for wrinkles and volume up during contouring, it will have the original shape. Hyaluronic acid may flow from the injection site under the pressure of the skin trying to return to. Risk of allergies. In rare cases, hyaluronic acid injection may cause urticaria and anaphylactic shock such as dyspnea, rash, and decreased blood pressure due to allergies. Since hyaluronic acid is a substance that is originally produced in the body, hyaluronic acid itself has few allergic factors and tends to cause less allergic reactions. If you are wondering if you will have an allergic reaction, you can take a hyaluronic acid allergy test. If you take an allergy test, you may have symptoms of an allergic reaction immediately afterwards, or you might have symptoms after a period of about 1 week, so take the allergy test 1 week before the scheduled treatment date. Hyaluronidase that can break down hyaluronic acid. In hyaluronic acid injection, the amount of hyaluronic acid to be injected and the layer of skin to be injected are determined in order to avoid failures, risks, and side effects. But depending on the skill of the doctor, the duration of the effect may be shortened or the result of the treatment effect. It is also a treatment that changes. Therefore, in the unlikely event that a serious situation occurs or the exposed result is not achieved, hyaluronic acid is dissolved with hyaluronidase that decomposes it and measures are taken to restore it to its original state. Hyaluronidase is a degrading enzyme that breaks down hyaluronic acid into water and carbon dioxide and absorbs them into the body. If you liked the video, please give it a like, share, subscribe to the channel and click the notification bell. Please follow me also on Facebook and Instagram. That would help me a lot. Thank you very much and see you next time.